Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to the Egg Whisperer Show. And I'm so excited to have Dr. Rahi Victory. Dr. Victory, you guys, like, what better name than that? He's basically a brother from another mother, and he is providing the best, most transparent and honest fertility care in Canada, in Toronto, to be more specific. Dr. Victory, thank you for joining us on today's show.
Thank you for having me. It's a pleasure to be here.
Awesome. So just tell us a little bit more about yourself.
Well, I'm a Canadian-trained OBGYN, and I went to Wayne State in Detroit for an American Board Fellowship in Reproductive Endocrinology and Infertility. And we have actually a practice in Toronto, and then we also have a practice in a town called Windsor. And we run labs in both sites, and we're rapidly expanding, so there's some satellites that are opening up as well. And our model is a little bit different than the traditional model. We're very patient-focused. And we really try and give patients options and choices rather than sort of pushing through one treatment or one mode.
And that's exactly why I invited you on today's show, to talk about how to make sure your journey is your doctor's priority. And it's your journey, not your doctor's journey, right?
Absolutely, yeah, for sure. And we want to facilitate that journey for our patients.
So for those of you who are listening right now and you want to learn more about how you can be Dr. Victory's patient, it's easy, drvictory.com, drvictory.com. And you also take care of international patients, including my patients from California. Is that right?
That's correct. We have patients from Europe, Japan, Russia, Israel, and we've been in contact with many patients from California and all throughout the US.
I love it. So you're all about transparency and honesty. So how do you start your relationship with your patients?
Well, our initial, sort of discussion is just a deep dive into their history. So I need to know everything about the individual, or if they're a couple, about the couple. We want to know about their journey getting up to the point where they've met us. We do a lot of sort of second opinion work. And so if that's the case, I need to know about what they've done before and where they're coming from. And you really want to know about what their expectations are from the process. Are they looking to use their own eggs? Are they looking to use somebody else's eggs and or sperm? Is it a same-sex couple or a heterosexual couple? All of these are critical elements. And then we really do a lot of in-depth evaluation of their psychological perspectives, their emotional perspectives. What are they aiming for with all of this? And what's their own history? Do they smoke? Do they drink? Are their diets appropriate? Are they getting exercise? How high is their stress level? So we really take a very holistic approach to the patient, because I think it's important that you address each and every one of those points rather than just kind of look at them and say, oh, your tubes are blocked, you need IVF. It's not just about needing IVF, it's about where that patient's coming from and where they're really trying to get to.
Wonderful. And I imagine there are a lot of tests that you're doing for your patients as well. What is your philosophy about testing your patients?
So we really like to be very comprehensive in our testing. We try to focus on addressing all of the major categories that we can in the testing to make sure we're addressing what we're going to need to know in order to give them advice as to what approaches would be appropriate or indicated. So from a male perspective, obviously, we're looking at all the blood work. We're looking at their STD screen. We do check male hormones. And then obviously an in-depth sperm analysis. And more, we are taking on DNA fragmentation as an important part of our screening for men. And then certainly if it's more complicated, where you're dealing with very poor sperm quality, there are additional tests we'll look at, including whether it's chemical exposures or vitamin deficiencies, whether you need an ultrasound and so on, and genetic testing where it's indicated for azoospermia cases as well. For women, it's a little bit more complicated. So we explore a whole month of monitoring for them with sort of natural cycle monitoring, as we call it, to see how many eggs they have, what is their uterine lining looking like throughout the course of the cycle. Are their eggs developing at a reasonable rate? Is it taking you 35 days to go through your cycle, or 28 or 40? And then we look at the tubal status and the cavity of the uterus. So I do a saline infusion sonohysterogram for everyone. And we do it extremely gently. There's a lot of fear out there about the SIS, but I've literally never had a single patient complain about our SIS procedure. So we're very gentle and delicate while we do them. And then we try our best to explore egg quality, which we all know is not the easiest thing to figure out, but we do our best with surrogate markers, with hormones, AMH. Again, we explore vitamin levels. I check vitamin D and ferritin on every single patient because we know that those can be quite important in terms of their success rates. And certainly for the patients where they have quote unquote unexplained, and I know most of us don't necessarily believe there is such a thing as unexplained infertility, I make sure that they don't have a history that is going to lead to a diagnosis of endometriosis or adenomyosis or tubal disease. And so we try our best to really dot every I and cross every T, so patients aren't left after waiting a month for the answer with, I'm sorry, I don't have an answer. We want to try and answer it as much as possible for every couple.
And how do you communicate test results to your patients?
I think that's probably the most important part of our job, to be honest. It's what we call in our practice an I1. It's the first visit that the patient is having after they've had a diagnosis of infertility. So we spend a lot of time at that discussion, first just explaining every single thing that the patients have found. So we go through the numbers. I explain what each hormone does. I explain what the number it had was, and then we actually say what that signifies, what that represents. We go through vitamin levels. We talk about the sperm performance, and I break it up into its component parts. So I'll tell them about their volume and their count and their motility and the progression and so on. So we really dive deeply into the data we've received from all the testing we've done. We show patients pictures of the uterus. We share, the screening of the sperm and so on. And then once we've done all that, we really have educated the patients, or at least I set it as my goal to educate the patients so that they never leave me saying, well, he didn't tell us what was wrong. I want every patient to leave saying, we know exactly what was wrong. He explained it to us. We understand what was going on so far, and now we know what we need to do moving forward. That's really the goal of that first discussion. So I feel at that point like I'm not really necessarily a doctor as much as I am a teacher, because it's my role to educate the patients about what's going on with them.
And then how do you counsel your patients about their different options once you have all the test results available to you?
Yeah, so I think that's the part where transparency and honesty is really important. So obviously, a lot of clinics can favor one treatment over another. If you're a satellite, you want to probably promote doing insemination because that's probably what you're doing there. And if you're a lab, you want to offer IVF. But for us, I just want to get the patients through their specific journey. So my priority is helping the patients achieve their priority. So we really lay out all of the options. And I start by saying that you could do nothing, because doing nothing is an option. And there's even data that supports doing nothing in some cases. So we really explain to patients they can start with doing nothing. Maybe they just need to change some of their psychosocial habits, smoking, drinking, drug use, marijuana. Maybe they need to change their vitamins. Maybe they need a naturopath or traditional Chinese medicine. And then you start getting into the treatment modalities that we use, which are things like insemination and IVF. And I do a lot of minimally invasive surgery. So if I feel that surgery is indicated, then we'll talk about the potential need for surgery. But we very much want our patients to understand that we feel that infertility is a loss of control for our patients, and we want to restore that control back to them. It's hard to feel like you have autonomy over your medical care without feeling like you have control to make your own decisions. So we really try to educate patients, give them the information they need, and then really explore with them what those choices are and let them make the choice as to which one is best for them. I always tell people, no one wants me in the bedroom with them. So they really need to be able to make their own decisions about what's right and wrong for them. They don't need me there in the middle of it.
And I tell people that my office is not as sexy as your bedroom. So, okay.
Yeah.
So let's say they've gone through treatment and you've done everything you possibly can as a medical doctor and a human being to help your patients, and the treatment isn't successful. What do you do then?
Well, we always go back over everything we've done really from start to finish. So we'll go back over their history, make sure we haven't missed anything along the way. We'll go through what they've done with us so far. Did we miss endometriosis? Would it be worth considering surgery in some cases? Did they have a fibroid that we, thought was not an issue, but maybe now is? Or are there other components of this that, we haven't caught so far? Maybe, the partner is smoking and isn't telling anyone or something like that. So we really do a fine-tooth comb review of everything that we've done. And then we really sit down and explain to patients that there are three components to the whole sort of fertility process. And that is the passage, the passenger, and the destination. So specifically, if we're doing IVF, we start talking to them about the passenger, which is the embryo. So was it a good quality embryo? Was it genetically normal? Do we think it was energy efficient? Did it have all of the tools and pieces and parts it needed to function and to stick and attach and grow? Then we talk about the passage, which is obviously us. So did we do a good embryo transfer? Was the transfer gentle? Did the patient have cramping? Was there bleeding? Did I clean the mucus? If it's a difficult embryo transfer, one of the things that we've really focused on, and I'd like to say really honed down on now, is doing transvaginal ultrasound guided embryo transfers. So if the uterus is retroverted, we all know those are very difficult to see on transabdominal ultrasound. So we do it with a transvaginal. You get beautiful visualization. You still get that same quality of view that you would with a normally positioned uterus. And then we talk about the destination, which is often the complex part of it. And that's, was the lining okay? Did you have compression of the lining after you started the progesterone? Were there contractions there? Do we think it was synchronous, if you believe in that? Do we think that there was a problem with the patient's immune system or with the problem with the blood flow and so on? So we address as much of that as we possibly can, because I really firmly believe that there doesn't necessarily need to be an end to a patient's journey. There's almost always something more we can do or investigate to help find answers for them. And it doesn't necessarily even mean that they have to do more treatment, but I owe it to them as their doctor to at least give them an answer. And I'm willing to fight for that no matter what it takes.
I love it. We need to make a t-shirt that says that and then have like hashtag Dr. Victory. Okay. I imagine it is so hard for patients to leave your practice. What do you tell them? How do you equip them for the next part of their pregnancy journey so that they are as educated as possible about what they need to know?
So I appreciate you saying that, first of all. I certainly want to be the kind of physician where it's hard to leave us. So I think it's really important for patients to feel educated and to feel like they need to advocate for themselves. Now, at the same time, I always argue online that patients shouldn't have to advocate for themselves, but I do want them to be prepared to do that, because I can't vouch for every other physician out there. And, certainly there are physicians that feel that they need to align their priorities with the patient's priorities. And there are physicians out there that feel that, the patients should just listen to them. And so I think patients have to be prepared to know what questions to ask and know how to navigate their journey with whoever they're with. And so we do focus a lot on making sure that our patients understand what they've gone through, understand the journey moving forward. And I frequently, during these second opinions, will say to patients, make sure you're finding a physician who is, willing to listen, who is willing to offer you options, who's willing to not impose their will on yours, but rather listen to you and hear you, and then see what they can do to facilitate what you're trying to achieve. So I think it's really important to find physicians that can align themselves with your priorities rather than, finding someone who just wants to put you through the cookie cutter medicine, because that's never going to work. Right. We always say that we're making babies, not cookies. So cookie cutter medicine does not work in fertility. Yeah.
I love it. You're making babies, not cookies. You guys heard it here on the Dr. Victory. I should call it the Dr. Victory show at this point. Okay, this is awesome. So I hate to see you go. I mean, like your patients, and I would love to talk to you all day long, and I certainly could, but I want to ask you one last question. And the question is, what is the one thing you would tell a fertility patient today who is starting their fertility journey? What's the most important thing you would want them to do or know?
I think patients starting their fertility journey need to have tremendous hope, because there are solutions for you. And I don't want you to go into it afraid, ashamed, or worried that you're not going to get help. There's lots of answers out there. And I think you need to find a physician or a team of physicians that is going to help you find those answers. Don't go somewhere where the goal is money, or the goal is just, sort of grinding you through the IVF machine. Go somewhere where your priority is their priority. And I think that's the most important part. Find a physician that's honest, transparent, and really values you as a person, not you as a dollar sign.
Awesome. Thank you, guys. Victory Reproductive Care, and the website is drvictory.com. And thank you, Dr. Victory, for coming on today's show and just sharing all your wisdom with us.
Thank you so much for having me. It's been a real pleasure.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.